guys. Thank you so much for coming today to one of our 3 sessions regarding our new telemedicine benefit. I am so excited about this benefit that we have, and if you have checked into this service before or know anything about it, it's innovative, it's cutting edge, but what it allows us to do is have access 24/7, 365 to a doctor, a certified physician for the employee and the employee's immediate family, regardless if you're on Tri-County's insurance or with your spouse or whoever. You and your immediate family have 24/7 access to a doctor now for free beginning January 1. So that happens through phone, via kind of like a video teleconferencing service. And we're going to hear more about that today. I have Jason Hopkins with us. Jason is from Concierge Benefit Services, and we have looked into several different options for our employees for telemedicine, knowing that it's a great benefit that we can bring on board to help everyone out when it comes to when you run to the doctor, it takes way more than 30 minutes. It's usually a couple hours by the time you get there. You go through waiting on the doctor, and then you get done. And this can be less than 15 minutes, and then it's done. So he's going to tell you about the service, a little bit more about it, how to use it, some of the perks that go along with it, and answer any questions that you have. And before you get started, though, I would like to add one of the things that we're also bringing on board to supplement this hasn't really gone out public yet, but Dava and the nursing crew and the students have graciously volunteered to pick up a few items so that before you call Concierge, if you want to go have yourself checked out to make sure you're looking at maybe a virus or an infection, she has a couple of things she can do. She's going to be able to run strep tests for us as employees. So she has a strep test kit, a flu test kit, potential UTI testing kit, and then she's getting an otoscope, and that'll be able to check for ear infections. So those are a couple of things that she can do. And the students, she's going to train the students to be able to do that for us. So they will be able to have some clinical time, some clinical experience doing the intake and assessment, so that when you call your teledoc, you can say, you know what, I just had my registered nurse at my workplace verify I tested positive with strep. Here's my strep test. Then it's one and done. There's no question on what's going on with you. So just wanted to add that that's going to be in place as well. I'll have more specifics on that and how it relates to your dependents a little bit later. I haven't quite got all those details worked out, but that is a service certainly for you as the employee. So I'll quit talking and just turn it over to Jason. Let him tell us a little bit more about this great service we have.
Oh, thank you. I'm done. That was pretty much it. So no, that's a great service. My wife's an RN, and if you could use that service internally here, I mean, the doctors, it's going to be an easy process. So please do that. We haven't. I don't know of any other situation with all of our clients that we work with where they've had access like that. So that'll be awesome to do that. But my name's Jason Hopkins, and like Tara said, we have a company called Concierge Benefit Services, and we do a lot of different services, but one of those is telemedicine. And in the nation today, telemedicine has been a very successful trend over the last few years. And about 78% of employers your size have telemedicine in place now. We have about 98% of our client base has telemedicine. We believe in it that much because we've seen the effects of it. My wife, like I said, is an RN. She was very skeptical of telemedicine from the beginning. And she's like, I don't know about this or that. And then she used the service. She's like, this is the greatest thing ever. And she's used it multiple times. But you have a handout in front of you. I want to go over it so we can answer questions related to the service that you have. That goes in effect January 1. So if you tried to go on or log on or make a call before January 1, you're not going to be able to because it's not an active account yet. So you'll have to wait till New Year's Day at least to use the service. The first call that you have into them, and I'm kind of jumping ahead, they're going to ask you, we've already provided the doctors and the nurses your information, but they're still going to ask you a lot of questions, and more the first time around than the second time that you call in, just to verify that it is you, to get to know you a little bit, and to make sure that they're servicing you the best way they can. But you have this handout sheet. It's a 3-page sheet, and let's just go over it quickly here, or not necessarily quickly. I want to answer every question that you have. But like Tara said, it's 24 hours a day, 7 days a week, 365 days a year. We have contracted as Concierge Benefit Services with a network of doctors called 1-800-MD. So you'll see that term 1-800-MD on some of your materials. That is the network of doctors that we use. Every doctor we use in each state has to be board certified for that particular state. So for Oklahoma, if you're at home here or at work and you call in, you're going to get an Oklahoma doctor. Typically, there's a handful of doctors that service on a regular basis. You'll get repeated the same doctor at times for time, and we've had great success with them. If you're taking a trip and you go to Disney World and you're out in Florida and you get sick or you get the flu or something comes up, earache, whatever the case may be, and you call in, you're going to get a Florida-based doctor while you're in Florida. And we'll go over all the state maps here in just a second. So that's kind of how it works. You call in, and there's a couple of ways. On this sheet, you have a number. On your ID card, you have a number. That's probably the number you're going to use most, is the one on your ID card, because that's going to be the most successful. That number on there, the 1844 number, I believe it is, it will lead you to a prompt. It's at my office, and say, do you need to talk to a doctor? Hit 1, and it goes to actually a nurse will pick up the phone. The nurse will ask you a few questions, see what you're dealing with, and what she's really doing is verifying that it's you and that it's not an emergency where you need to go to the ER right then. Because obviously, if you have a broken arm, they're not going to be able to help you with telemedicine services. But there's about 70% of what you go to the doctor for that they can't help you with. But anyway, she'll ask you a few questions, verify that it's you, get some information, and then she'll say the doctor's going to call you right back. Is this the number I need to call you at? And she'll verify that. The doctor will call you right back at that point. We average very, very short time frame. Contractually, they have to call us back within an hour, but we've been averaging, the one that my assistant had last week was probably 3 minutes. If you're waiting in that, I would be shocked if you have to wait very long to get a call back. The doctor's going to call back. He's going to say a few questions, verify that it's you, what's going on, give you a diagnosis, and then potentially, if it's needed, we'll call you in a prescription. So if you need a prescription called in, be prepared to tell him what pharmacy you want it called in at. So he will not prescribe narcotics. No narcotics. But he will do things like Tamiflu, my allergy medications. It's a great thing. I can call in and say, hey, I've been taking Singulair for years. I need a prescription for this, and this is what he'll call in. So there's a lot of things. I can give you a complete list. There's a few things on here we'll go over. Okay. Things like allergies, arthritic pain, flu symptoms, bronchitis. If your nurses say that you have it, the doctor's going to love that and confirm it and get your prescription for you really quick. Now, the pharmacy will text you back in most cases. So what's really neat about this is you could be at home, you could be at work, and at your convenience of your home at midnight, you're feeling terrible, you call in, you talk to the doctor, he calls a prescription in there, you pick it up as soon as you can at the pharmacist. It was this summer, so it's been 6 months or so. My wife was in Lawrence, Kansas, and she had a migraine, and she gets migraines on occasion, and it was bad. And she was at the hotel, so she called in and said, "Hey doc, had a migraine." They looked at her record and said, "Yeah, we see that this is a pattern here." Called in her medication at CVS in Lawrence. She went and got it in an hour, and she was able to stay there. Otherwise, she would have been in the hotel room the whole time. So that's the type of thing that happens. We hear stories one after another of success of using it for convenience. You're not sitting in a waiting room with a lot of sick people. That's why I like it. But the success rate, it's also very good from the employer side. It really, you're not missing a half a day of work, those types of things. So the program is what it's called it's URAC accredited. And I only mention this as it's very, very detailed. I've gone through URAC accreditation. It's probably not like the Baldrige, but it's a lot of work to get accredited. So this program has been certified. There's a lot of credentialing that goes on a continual basis with the providers to make sure that they're quality providers and that all processes are being handled. Okay, any questions on page 1 there? No. Okay, page 2 is kind of how it works. We've gone over that a little bit, but I tried to break it down in 3 easy steps. And you can do consultations by video. Most people tend to do by phone because it's quicker and easier. But you can absolutely do a video consultation if you want. That's completely up to you. But you call the 800 number. You can call the number on the card. There's also another 800 number here. They're going to ask you for a little bit of information, and then you're going to get your call back and your care. It's really that simple. There's not a lot of complication to it at all. The first time, yes ma'am.
Sorry. You mentioned that he looked at her record and said I see you have this medication before. Does that mean that he has access to her record or just the pharmacy stuff?
Only what she's used with him before.
Oh, okay.
They're not going to go pull records from the doctors in different places like that. They'll keep a history going of your calls and services they provided you, but they're not going to gather information. In other words, if you want to provide them with some information to have on file, you can do that. That's completely up to you. But she had called in for that same service several months or a year before, and they had that on record. Good question. Good question. If in doubt, call and ask about it. Call and ask about it, because even if they can't treat it, they're going to give you some good information that's going to help you in the processes of being treated for whatever symptom you might have. So don't be hesitant to call them for anything. That's what they're there for. That's why you have the service for. So even if you have a question about some treatment you're currently getting, call and ask them. Call and ask with unlimited number of calls or consultations, whether it be video or whatever. There's no limit on it. There's no copay when you call in, so it's not costing you anything. Your employer is covering the cost, which is great. It's awesome of them to do that. Yes, ma'am.
Question, sorry. Okay, say they call in, they are told they have the flu.
Mm-hmm.
You know, with the flu, can't go back to work.
Mm-hmm.
You miss 3 days work, you need a doctor's
Mm-hmm.
release. So do they give that as well?
Absolutely. Great question. And that's on my list to get to. So that's, no, I'm glad you asked. Perfect example. Anybody that has kids is going to need a note. They will give you a note. What they do is email it to you. So you may want to request it from them just to remind them. Most of the time they'll ask you, especially if it's a dependent of yours, if you need a release note or a note of diagnosis or whatever the case may be, and they'll email it to you or text. But most people take it email so they can print it off and take it in. But yes, absolutely. My daughter likes that. You can get a note. This is if you have a temperature at all, or you think you do, take your temperature or get your temperature. That's one thing that they're going to ask, and in almost every case they're going to say, "Are you running a fever?" So if you really think you are, it's always good to see if you are, or say, "Yes, I'm burning up. I don't know what it is, but I'm hot and I do have a temperature," or "No, I'm not." Whatever the case may be, but they're going to ask that question almost every time, or they have to me anyway. So. They have Spanish. They have there's about 170 languages that they have. The way that they do that, because it has to be a state board certified physician. So if that physician does not speak another language, they bring in an interpreter. At that point, when they bring in an interpreter and they have a service, You know, you've seen those services. There's a PHI agreement there with them, and it's totally protected. But there's an interpreter if you have somebody that speaks another language, they can use the service. It is for your entire household, so not just for you as an employee. So if anybody lives in your household, they can use the service. We did collect some dependent information. It may not be everybody's, that's okay. They're going to confirm with you that they are a member of your household, but they can use it. Yes.
Are they doctors that are like in a hospital setting, or are they like in a, like when you call them, where are you going to be talking to them at? Are they going to be at a home, or?
They could be a couple. Some of the doctors have private practices, and they may be at their practice. Most of the doctors throughout the country that are in network are ER doctors, and they're taking these calls when they're off duty on ER because of the shifts that they work. That tends to be the case. Most of them are ER docs. Not all of them. There's 3 or 4 that we tend to get in Oklahoma. One of them is a female doctor, and the others are male doctors, but they tend to be, all of those are private practice doctors. They specialize in something, and they do this also as a supplement because they do well at it. And so Oklahoma's a little different. Most states are ER doctors.
Jason, as your family dynamic changes inside your household, do they need to be updating their census information with Donna or I just to make that change?
They can, or on your card or in your letter that you have received there, you'll see where you can log on to a portal.
Right.
MyBenefitServices.com manage. That portal that you go into, you can update your household information at any time.
Awesome, very good.
So you use that portal to keep track if you have changes, or your mom that's been living with you moves out or moves in, or whatever the case may be. You can go on there and update it, or you can call us and we'll update it for you. Either way.
So the definition of household is someone living in your household?
Yes.
Or
Well, you're going to have you may have some college students away. If you're paying for them, that's household.
So it has to be covered with our insurance, is that what you're saying?
No.
Are you supporting them? Are you taking care of that person, if so?
I will tell you, and that's a great question. 1-800-MD.
Child that maybe spending the night with you gets sick, you
No,
can't
no,
call in on that?
no,
Okay.
no. We don't police that heavily. Probably should police it more than we do. I shouldn't be telling you we don't police it that heavily. But it can't be somebody just visiting or somebody down the street, but if you have a parent that lives with you, an aunt that lives with you, stepkids, whatever the case may be, maybe they don't live with you all the time, but they live with you some, we would take that. That's fine. Yes.
Nursing, do family members get those benefits also as part of the strep test?
I'm working on that, seeing on what that looks like. We're doing employees for sure, and then I'm kind of checking into the details of that. Hopefully can have something to you mid-January on that.
Yes, ma'am.
So recently, there's been this lovely little virus that's gone around that kind of mimics strep throat, but it wasn't strep. So can you walk us through, like, if I called in with my 3-year-old son and I gave the doctor all the symptoms of fever, sore throat, how would, without having David do the strep test, how does he know whether he needs to prescribe an antibiotic or not?
Right. He's going to ask you a zillion questions, and he's going to say, hey, this is going around, and these meet all of the symptoms that associates with this particular illness. If he has any doubt, he's going to tell you to go to the doctor.
Okay.
I mean, he's going to refer you to the doctor. He's only going to give you a prescription or call one in if he's sure that's what it is.
Okay, so he's not just gonna err on the side of, here's the antibiotic.
No, not necessarily. Well, maybe an antibiotic that's not, he might err on the side of giving you an antibiotic. But I've been denied. I've called in for things and had the doctor say, you're not that bad. You need to have
Suck it up.
Suck it up, have some vitamin C and do these things, and if it's not better in 3 days, call me back or whatever. So they're very cautious and not just writing a script after script after script. That's not their purpose. This is a practice. It's part of their practice. You are going and seeing a doctor without seeing a doctor. It is a doctor visit or consult, and they treat it very much like that. It'll be a very professional call.
And you'll know the doctor's name and stuff, and you can write all that
He
information
will
down.
immediately tell you who he is and identify himself, or herself, the very first, as soon as he answers. They'll tell you when you call in that you're going to receive a call back in a few minutes from an unknown number. Because the doctor doesn't want necessarily his home number or the hospital number where he is disclosed. So it'll come back on your cell phone or wherever you're calling from as an unknown number. They'll say, please answer it, because it's going to be the doctor. The doctor, you'll say hello. The doctor say, hey, this is Dr. Lee. I'm calling for you or whoever, and is this who it is? Then he'll verify also to make sure he's talking to the right person. So he's going to want some verification. If you have your card in front of you, it makes it a lot easier. If you don't, you can still use the service. It's going to take them a few more questions to verify it's you. If you have your card in front of you with those numbers on it, speeds the process up tremendously. Once you do it, I promise you, it's a piece of cake from then on. It's just doing it the first time.
Can you tell us a little more about the video consult?
Yes. If you look on your back page, there's a big map. And over time, this map's turned green. When we first started doing this, there was a lot of different colors on the map. Now there's one state, Idaho, that only takes video consults. The rest of the states will take phone consults or video consults. Video consults are just like a Skype situation, where you're in front of a camera, the doctor's in front of a camera. I've seen where video consults were good in some instances where you've had a rash or something like that, although you're only at the quality of the equipment that you have. So understand that unless you have really good high quality equipment, he's still going to go through the processes, the same process as he would on the phone. It's nice sometimes to see the doctor and talk to him video face to face. So I strongly encourage you doing it. If you have that capability, please do it. You need to tell him on the initial call when you call in and talk to the RN, I want to do a video consult. So he's prepared. So he can be logged on and ready to go. But that's it works the same way as a phone consult, except you're just talking over the computer screen with the video.
Can you send pictures?
Yeah,
Absolutely. And they would probably encourage that.
It was one time one of my kids had like an eye thing. I'm like, I know this is not pink eye, but and
Yes.
I took a picture and sent it to the nurse, and she's like, I'll show it to the doctor. And it was just a cold in her eye. But
Any information you can give them like that, they love that.
okay.
And please do. You
And
may
they'll
have to ask.
give you a number or email or something to send the pictures to.
You'll send it to the nurse that made the initial call with you, and she'll give you that information, or the doctor will give you that information to do.
Yeah.
But absolutely, they'll want, if you have any type of picture documentation that would help the situation, they'll want it.
Yeah.
Absolutely. They want as much information as they can get, so they do the right thing.
Pictures would be more clear than video conferencing probably.
Yeah, I mean, if you have good equipment, they usually do have very good equipment. It works. But most of the time, most of what you're calling in for, there are times with rashes or pink eye. That would be a good scenario. Most of the time, it's a flu or, earache or whatever the case may be that you can't really see, necessarily. So. But yeah, does that answer your question on video? They send you kind of an instruction deal because, and you won't have that in advance because it depends on where the doctor's at. So you have to have, you both log into the portal and video. So you'll get that instruction on the time you request the video consult. Nobody remembers that information anyway, so you have to get it each time you go through. Strongly encourage you to use it as much as you can. These claims, it is not a claim. It is not insurance from that perspective. So your insurance is not affected by your telemedicine use. And that's important. So you don't have to give them your normal insurance coverage card.
Electronic medical record.
They do, but that's not, it's not really the model that they use. There'll be times that on certain people, they're not gonna go back and look at all your medical records for the flu. That's just, they're not gonna do that in this case. If they get heavily involved and you've got some things that are serious, they're gonna refer you to somebody else anyway. Or they may request medical records at that point and gather some data and get back to you. But that's rare. That's a rare case. Telemedicine's really for, right now, you can take any medical plan out there, and there's about 60% of items that are treated in a doctor office or clinics. That's what telemedicine's really for. Those are the items, if you would go to urgent care clinic for it, other than a broken bone or something like that, or Gap Clinic or wherever, that's probably you can use telemedicine for in a lot of cases.
Save yourself a copay.
Save yourself a copay, save yourself time of going and setting them there, and plus it's kind of cool. It's kind of cool to do. So. All right. Any questions that you have on that card, when you call in that 800 number that's listed on there that goes to our office, we have somebody in our office locally. I have two offices, one here in Bartlesville, Oklahoma, one in Omaha, Nebraska. We're relocating our offices right now, but you'll get one of my employees in either Bartlesville or Omaha to talk to. If you need a question, have any questions, call us.
And that's 24/7. There's always someone.
Oh no, we're not going to be there 24/7 to answer those questions during normal office hours, but they can answer your questions 24/7, absolutely. But if you have one for us,
So this 844 number isn't your office. That's just straight to the medicine.
that's our office.
Okay.
And then when you call that 844
You
number,
push the one.
you push the one for telemedicine, and it takes you to the doctor.
Gotcha.
But you can push 2 or 3 or whatever. I've listened to prompts to get one of my employees. So. Any questions?
So do we need to go ahead and register on this portal?
You can. Your information should go active January 1st because we've already received it.
That's what I was gonna ask. So I got an email and it said something about registering, but I didn't know if that
Yeah.
was what we already did when we sent in our
You
stuff.
kind of already done that.
Okay.
Now I will tell you the first time you use it, or you might want to go in there after January 1 and just check it and make sure it's all correct and updated. We've made mistakes before, so it doesn't hurt to check it. But you can't do that until January 1 when you're active. But you shouldn't have to do that. We already have all that information, but you're more than welcome to go check it
So
out.
after January 1, we should be good to just call in and use the service.
You should be good to call in and use the service. They're going to ask you a little bit more details on the dependents, even though we have some of that information. So just know the first time a dependent uses it as well, or somebody in your household, there's going to be a few questions. It's not much, but a few questions just to verify.
So on the employee portal, do the employees have a chance to update address?
Anytime they'd like.
Anything? Okay, add dependents?
Absolutely. Yeah. Encourage them to do that. I'm glad you mentioned that, because you really want your phone number and your email address, dates of birth, things that they might use to verify that you're who you are, updated. So if you have changes in those, strongly encourage you to go update those.
And Jason, I just want to reiterate that as the employer, we don't see any diagnosis or anything like that. We will be able to see frequency of use just to see if the program's being utilized, but that's the extent, right?
Correct. Right. It's treated the same PHI and information if you're going to the doctor and visiting the doctor. If you go to the doctor right now, they don't send your information on to anybody at your employer, and this doctor will not either.
And we don't, in Barnesville, we don't currently have any 24-hour pharmacies, do we?
Walgreens used to, do they not still do
I don't think you can get a prescription in the middle of the night or anything. So if we did call in the middle of the night and we need a prescription, and like, let's say I use Boulevard Pharmacy downtown, and so they would get that prescription, they would get the order the next morning.
They would submit that prescription right then, but Boulevard wouldn't get it until, if that's who you use, wouldn't get it until the morning.
But they go ahead and put it through right then?
Right,
and
they
then
put it
when
through,
get it to
yes.
them? Okay.
Yeah, and if you give them the like when I've used it, I said, hey, I want to pick it up at Walgreens on Frank Phillips,
Mm-hmm.
and they have that data already in the database,
Mhm.
so they'll have Boulevard in their database, and so you just have to give them maybe a phone number of the pharmacy or a location or
Mhm.
the name, you know, somewhere to verify that's where you want to pick it up.
Yeah.
So that's really it. It's kind of a call in and doctor calls you and goes through a diagnosis, and he'll tell you, you know what, I don't think you need a script, or yeah, this is what you need and you need to try. And a lot of times he'll want to follow up with you in a few days to make sure it's working. So he'll tell you that up front. He'll say, I don't need to follow up with you after this, or expect another call from an unknown number on Thursday, because I want to follow up to make sure it's working. So
And we can still use it when we're traveling, it'll just be a doctor from that state.
correct. All states.
And their link, they'd still have the information of if we've called last week and had.
Correct,
something.
yeah. Yeah, doesn't. It's all done by that member number and name that's on that card, so it doesn't matter where you're at to use it. We've used it within my office in probably 3 or 4 different states as, you know, my group of people, and had success with it. We do have members on it in all, well, I don't know if we have all 50 states, but probably 40-something states right now. So
It could also be like a situation where left town, oh my gosh, I forgot a prescription I take routinely, call and say I take XYZ prescription at this milligram, they'll probably prescribe you enough to get you through till
you
get
got
home.
it.
Right.
Absolutely. Yeah. That's what they did with my wife with her headache. I don't know the name of the medication she takes, but they gave her enough to get her to when she comes home. So.
Yeah.
I just realized you already answered my question.
Okay.
So,
Yes,
one
ma'am.
more question. So each dependent or each household member has their own member ID, right? Is that how they identify? So like if a mother calls for her little one, does she have to pack all 5 or all cards?
No, it'll be the same member ID.
Oh, okay.
Yeah.
So-
Now you'll have one member. The member ID will be for the employee and the employee's household.
Okay.
But you'll have to verify each by name and date of birth and
Sure.
social, whatever the case may be. But the only one member ID. You don't have to keep track of.
Okay, that's what I. well,
So if you
okay.
wanted to give one of them each a copy of that card that's in your household, make a copy and give it to them. Absolutely.
So is this information trackable? I mean, like, if you go to apply for life insurance or whatever, and, some life insurances, let's say that this telemedicine, he says, well, this sounds like arthritis, and, you know, I'm gonna give you some pain medication. And so, like, if you go to apply for life insurance, they're gonna wanna know, okay, you got arthritis or not, and so is that,
It doesn't change anything you would currently do for a Life app. I mean, you disclose, on a Life app now, you disclose what you have,
okay, but if,
and
I mean.
then they'll do a
it
biometric
suggests
screening.
that it might be, but your family doctor hasn't
Right.
confirmed that.
If he says it might be, I'm not gonna put that on a Life app. I'm gonna put what's known.
Well, they'd probably say have you follow up with a physician.
Yeah.
Like your normal physician.
Yeah, if it's an arthritis, something like that, they may give you something kind of like that temporary deal to get you by for the day or two. They're going to tell you, you need to go to your doctor. You need to go have this checked out. And here's the questions you need to ask your doctor, which is kind of helpful. Because so they'll kind of coach you on how to follow up with whatever physician you're going to see.
good.
They're very detailed. Actually, I have great doctors here, so please understand. Great doctors. Some of them are very good friends. I've actually probably received more detailed service and spent more time in some cases with the telemedicine doctor. They don't rush the call. There's no, they're not trying to get you off the phone. Some of the calls I've had, because I've had a lot of questions, have gone, 20, 30 minutes. So please ask them everything you want to ask them. That's what they're there for. And I've even had them give me certain diets to use, things of that nature. So utilize them for whatever your needs are.
Thank you very much, Jason.
All right, thank you. Thank you. And please, don't just not use it because you have a question. Get your questions. Please let us answer them if you would, please.
We're very excited about this benefit, and I'm glad you mentioned that, not to, add too much to that, but in a conversation the other day with Dr. Britt, he shared with me that when seeing patients, after 7 minutes, basically the insurance only compensates that doctor for 7 minutes. Anything over 7 minutes, it's on his dime, So kind of talking about rushing the process a little bit. That's good information to know. So this is exciting. Donna and I are here to help you if you have questions about it, but I think it's fairly self-explanatory. I'm excited to hear any success stories. And in fact, this has kind of shaped the way that we've had some employees look at their insurance and what insurance they're purchasing. And so you might kind of see how it works for you this year and keep that in mind as we go into open enrollment next year and see how it works for you. The other thing I might add is there anyone in the room who has this service, a telemedicine service, with their spouse or in another way right now? I know some Conoco.
It's offered, but you have to pay for it.
Okay. I know some Conoco people have it, and Phillips possibly.
They do.
And maybe some others. And my suggestion was going to be, if you have it somewhere else, please let us know. It doesn't benefit you to have duplicate telemedicine coverage. It's not, you're not paying anything, so there's no benefit there. But there's, it is a cost to the school. So if you have it in another capacity and you're not having to pay for it, it's being paid for by that employer, you're already covered, please let us know and we'll talk about what that looks like and maybe make some recommendations on that. Okay, any other questions? Donna, did you have anything else?
Indian, did you mention Indian?
What did you find out?
Do you want to share? I'll let you share since you're kind of...
What I did find out is that they only will fill prescriptions from Indian Health Services, or if they refer you to a specialist, and the specialist calls that in. So if you primarily use Indian Health, Telemed probably is going to benefit you as well. So,
Good to know. I didn't know the answer to that.
yeah, I discovered that too, that I wasn't aware of.
So you're saying if you use
If you
telemedicine, they
primarily
won't call you
use-
in a prescription if you...
Well, Indian Health will not pay for the prescription, so they won't cover that expense.
Oh,
So like,
if they call it in.
if Telemed calls it into Walgreens will file it on your insurance.
Right.
And then you may be out of pocket $5 or $10 or something.
Yeah.
Whereas Indian Health, they may fill it, but they won't pay for it, is my assumption.
Yeah.
And they may not even fill it, I don't know, only if the Indian doctor prescribes it, or they send you to a specialist and the specialist prescribes it.
Will the Indian Health pick up the cost of the prescription? So then that's where I think you weigh your options. You say, okay, do I take 4 hours out of my day to drive to Indian Health, knowing that I need a antibiotic that without insurance costs $4 anyway? Or do I just call Teledoc, tell them what's going on, and I
Plus you have to get up at like 7 o'clock in the morning.
Yeah, that's what I'm saying.
Fast,
Yeah,
fast, and you might not even get an appointment.
Spend 15 minutes, go through the Teledoc, and I'm willing to pay cash for my prescription.
Yeah.
Yeah, don't you think that's a fair, yeah?
Just weigh your
But of course, if your prescription's
Seven.
$700, then I'm gonna spend my 4 hours at the Indian clinic and then do what I need to do, right? All right, thank you guys so much. We appreciate it. Have a good day.